Ever wondered why male fertility is also equally important when you are trying for a pregnancy? Because most of the time it is assumed or it is thought that the fertility is related to female, it's all about female infertility. But according to the statistics, did you know? You'll be surprised that 35 to 45% of fertility issues is because of the male factor. Now, this could be because of the count being low, the motility being very low, or it could be lifestyle related issues which could be the contributing factor for fertility problems. So it is extremely essential that men's health is also very optimal when you are trying for pregnancy, or even to enhance your chances at IVF. The overall health of the men's fertility health is extremely essential to get a very successful outcome when it comes to IVF treatment. So hey, hi, I'm Dr. Indu from Samrudh Fertility and Urology Center, and today I'll be going a little deeper into the male fertility challenges and in which all situations then you need to go through IVF kind of a treatment, and how you can enhance your chances of pregnancy with the treatment taken at the right time. This is very essential. And hear me out what I say. So coming to the various causes of male factor infertility. Now, I'll just go through the common causes that we come across. So, when we encounter the count being on the lower side, most of the time, what is noted or seen is that there is no cause found as to why the gentleman's count is on the lower side. This is the most commonest uh, practical thing that generally a fertility expert comes across. But if one has to enlist what are the different causes of male infertility, then the thing is, if you have had any infection in the past, sexually transmitted diseases, this will impact. If it infects your tract that transports the sperm from the testis to the ejaculate, then this, if this passage is blocked, then this could be the reason for male infertility. Then if you've had any surgery such as inguinal hernia surgery or in pelvic region surgery, or if you have had undescended testis, that means your testis is not in the scrotal sac and that is somewhere in the abdominal cavity. Now what happens when the testis is in the abdominal cavity and this is not kind of picked up at the right time, then all that sperm germ cells that are there through which the sperm gets produced, that cannot survive in that abdominal environment temperature. So if this is delayed and that testis that was there in the abdomen, it is not brought back or it is not operated upon and brought into the sac, testicular sac, then the sperm that were there, the germ cells that were there, they will get damaged, and that will also be one reason for you having the fertility issues. And this gets picked up only accidentally by an examination or by some scan sometimes. So this is something that is also another reason for male factor infertility. Now, if you have had any kind of testicular torsion, and the torsion, if you in the sense that testis is just, it rotates on itself, and by this rotation what happens is the blood supply gets obstructed, and if this is not derotated or it is not kind of untwisted at that time, then the testis is damaged permanently. So taking action or treatment given at the right time, that surgical correction is, if it is done at the right time, then that will definitely help and maintain or retain the fertility potential of that man. So this is one thing. Then if you have had any kind of a tumor or any kind of a cancer, then that will definitely impact, because when it comes to this particular aspect, then generally the treatment modality most of the time is removal. And before removal, one considers freezing of the sperm before going ahead with any kind of fertility treatment, if this is diagnosed at a adult stage, isn't it? So the tumor is another aspect or another cause for male factor infertility. Then when it comes to it can also be genetic in nature. As I said in the beginning, that is, no, there is no cause, but sometimes there is a genetic cause found, and if that is determined, then one can actually diagnose that by doing the pre-implantation genetic testing and ruling out that particular gene from the embryo and eliminating that embryo and putting only those embryos that are unaffected by that particular gene. So something some genetic history that runs in the family, you should bring that to the notice of the fertility consultant and discuss about that. You may need to then have a discussion with a genetic counselor and the fertility expert, and then come to or arrive at a decision as to how to go forward. Last but not the least is ejaculatory dysfunction. Now, this is again something which is another commonest cause of male factor infertility that fertility consultant comes across. Not able to have erection, or not able to ejaculate, or erection doesn't long last, so intercourse doesn't happen. So these are the situation where then natural chance of conception gets affected. Now, any kind of ejaculatory dysfunction will also be a reason for infertility, but most of the time this is tackled well, either by giving proper counseling, or right kind of counseling is what is more important, and then trying to correct the correctable problems. Also, sometimes medications help, but otherwise, if you are able to ejaculate and give the sample, then that is helpful to at least do the assisted reproductive treatment like IUI or IVF. Sometimes the gentleman is not even able to produce a semen sample, then that becomes very, very challenging, and we come across such situations sometimes. And then the measures of doing sperm banking, in the sense whenever they are able to collect the sample, they do it at home, quickly get it to the center within 20 minutes, and it frees a sample, so that that kind of sperm is utilized for IVF kind of a treatment. So these are some of the different causes that one can have, which is the cause for male factor infertility. So now, having understood the different causes, now definitely one wants to improve the fertility by various ways. So, what are the different ways in which you can improve the fertility? So, first and foremost is the lifestyle factors. So, definitely look into yourself and see if lifestyle factors are disturbed and that is contributing to the sperm health. So, this is something what I'm seeing commonly, and you all must be aware of this, is our diet and exercise, which is getting affected. The diet is mostly, if you're having more of outside food, more of junk food, then this will definitely have an impact, because then the food that is more junk in nature is not favorable for the sperm environment, the cell environment, right? Number two is, it is diet. Then next is your exercise. If you're someone who is having a sedentary lifestyle, then this will definitely have an impact on the quality of the sperm. So having regular and exercise, one who is having regular exercise, actually there are studies to say that with good diet and regular exercise, the cell environment is also very conducive, and the kind of sperm that gets produced is more healthier with less DNA fragmentation also. So diet and exercise is really very important, and if this is something that is altered, then just correcting this aspect and taking care of that, in next 2 to 3 months you will see that even the sperm health will improve. So other than that, if you are having any other associated medical condition, don't ignore it, and don't avoid that, or don't run away from it. You have to take control of sugars, and if you bring the sugar under control, bring your HbA1c level under good control, then that is another good thing that you do for your sperm health. Okay, so BP likewise. When BP medication, if somebody is on BP medication, that might impact your ejaculatory function. If uh, one is on a very prolonged treatment of hypertension. So check out with the doctor, understand, explore the options. So having that control is very important. Another test that we don't miss is about the thyroid and also the prolactin levels in all gentlemen when they come for the fertility evaluation, especially the male fertility. So even this, it's not that men cannot have thyroid issues. Women are more commonly known to have thyroid problems, but men cannot be excluded. So they also can have thyroid issues. So If your count is on the lower side, so all this assessment is done in the beginning, your hormonal profile is done, and if the thyroid comes as abnormal, then definitely just correcting your thyroid will bring your uh, count under normal. It will come to normal. So this is also very important. So these are the medical related issues that if it is identified and corrected, then this will definitely maximize the quality. If the quantity doesn't improve, but what happens is with qualitative improvement, the treatment that is given will have a better chances of success than having no treatment at all for these medical related issues. Yes, sometimes so for some gentlemen, the hormones which are basically regulating the sperm production is extremely low. We call it as hypogonadism, hypogonadotropic hypogonadism, where some of the hormone comes from the brain, which will actually stimulate the testis, and that's how the production of sperm happens. Now, for some, this hormones that is coming from the brain is not really getting released, and it is very low, lower than we call it as 2 milli international unit. If that is very very low, that is the FSH and the LH. Those are the hormones, gonadotropins, that we check for gentlemen with extremely low count or no count. And for such men, what happens is you are able to give them a weekly or bi-weekly hormone injections for nearly 6 months to a year, and one can see the result in terms of sperm count becoming better and better. And this category of men stand a very good chance of achieving spontaneous conception with a natural drive. However, they need to take these injections very regularly. Only until the time they take the injections, the sperm is going to get produced. The moment they stop the injection, then the sperm production is also going to get stopped, because that mechanism of the stimulation that comes from the brain is missing. So we are helping by giving you injections on a regular basis. So you have to utilize that treatment till the time you achieve a pregnancy. And the treatment will be minimum for 6 months to a year's time. It can be more also, depending upon what stage of fertility you are in. And then coming to what other treatment. So this is majorly these are the treatment. When it comes to cancer, I did say that for cancer, before you go ahead with the kind of treatment, you can freeze your semen, store it, and then take the treatment, so that in future when you get married, then you can go ahead with the assisted reproductive technique treatment and utilize this frozen sperm and achieve a pregnancy. So this is possible by taking this kind of an action in situations where you are facing this particular condition of cancer. So this was all about different causes. What ways you can improve your fertility by general ways, natural ways, or medical ways. Okay, so you've done all this, and then if suppose you fall into the category of you have to take the treatment, assisted reproductive treatment, then I will just enumerate what are those. Now, if the count, one is, everything is normal, everything is unexplained, count is good, wife's tests are normal, tubes are all fine, then you have to actually go ahead with the IUI kind of a treatment. In IUI, what is done is that here you are, you are stimulated, then eggs get produced, only one or two or maximum three, and then on the day around its ovulation, the sperm is deposited into the cavity by using such kind of a catheter, and it is put here. So this is IUI treatment. And for whom do we do IUI treatment? If it is unexplained, that is one. Then number two, if the count is not very low, but then it is again not normal, something like 5 million, 6 million, decent motility. In that scenario also, one can do IUI by actually pooling the sample. One can either pool fresh samples, that is giving the sample of semen twice on the same day of IUI at a gap of 1 hour, and then process the sample and increase the total motile sperm count, and then deposit. So the minimum count that one needs for IUI is 5 million motile sperm count for getting that normal chance at pregnancy. So in IUI, the pregnancy rates are around 10 to 15% and not more than that. This is something that you need to understand. wherever, whichever place you do IUI, that is the success rate that one gets, and it is not more than that. You can read through any articles. So this is IUI treatment. So if suppose IUI is not working in unexplained infertility, then one has to consider IVF, because if IUI is not working, then there is some aspect which is not getting corrected by this particular treatment, or there is some subtle reasons at a molecular level where we are not able to identify by simpler treatment, then you need IVF kind of a treatment. So IVF is for those men where the count is really very low, then definitely you can't wait for simple treatment, directly go for IVF. Here, what is done is that best sperm amongst the motile sperm population, best one is identified, and one sperm is injected into one egg. So this is called as intracytoplasmic sperm injection, done for very low count of semen. For those who have unexplained infertility, where count is good, still pregnancy is not happening, but the count is very good, motility is very good, then one can do IVF for such couples in the laboratory. In the sense, sperm and egg are kept together and natural fertilization happens. Okay, so this is also possible in the laboratory. Now, other than that, so this is how one can achieve fertilization of the egg by injecting the sperm into the egg. So these are the advanced technique that one does for achieving the fertilization, forming the embryo, and then finally putting the embryo back into the uterus using the catheter. So this is all about the advanced treatment that one has to do. So one more thing that I had to say was also about the sperm DNA fragmentation index. So if the person is having unexplained infertility, if the couple is going through unexplained infertility, then what is also assessed is the sperm DNA fragmentation. If the sperm DNA fragmentation is on the higher side, then you are given some medical treatment in the form of antioxidants, micronutrients, and also advised to take diet, other diet changes, increase your fruits content, consumption of fruits, vegetables, because they are rich in vitamins, micronutrients, and antioxidants, along with your medication. So for DNA fragmentation index, which is higher, again you have to go back to the lifestyle. So is your sleep disturbed? Are you, too stressed at workplace? Are you having other habits like smoking, alcohol, excessive caffeine? So these all are again very, very important to be tackled. So the four things is, excessive use of caffeine, coffee, tea, then alcohol or smoking. Smoking is really, really dangerous. And if you're very, very obese, if you're having a sedentary lifestyle, you have food addiction, even that is not going to really work. So all these are going to have an impact on the sperm quality negatively. So even for fertility treatment, advanced fertility treatment like ICSI, that is intracytoplasmic sperm injection to work, you have to have all these other corrections done and have that set right, and then take the treatment to enhance the chance. So you understood about how the fertility is assessed, what is the quantitative assessment, qualitative assessment, then what are the different causes and how one can correct, and improve your fertility health, the sperm health. So when it comes to the other test, so only basic test is the semen analysis. Other than semen analysis is the sperm DNA fragmentation index. And apart from these two tests, there is hardly any other test that is needed or essential to understand the male infertility. So these are tests that are done. Other than that, it is only lifestyle correction that you have to go through. Now, when it comes to IVF treatment for any couple and they are facing the challenge of male fertility being affected, then as it applies to the women, same applies to the men's health also, that before embarking on the IVF treatment, check if you are physically all well, you are medically having no other issues. Even if you have, then that is corrected and that is in control. Be it BP, sugar, diabetes, weight. When I say, I understand you can't lose so much of weight, but at least losing like 5 to 10% of your body weight will really do wonders. And being physically active, exercise, you may not be losing, but if you are exercising every day regularly, that will definitely have a very good impact on the overall cell health and the sperm health also. So before you embark on this IVF treatment, get all these things checked and corrected. And also remember, even our mental health is very, very essential. So if you are under a lot of stress, work pressure, so address that by taking the help of yoga, breathing exercise, pranayama, and meditation. Even this is going to have an enormous benefit when it comes to improving the outcome of IVF. So even one more thing is the medical treatment. One was injectable. Now this medical treatment, sometimes those who are really obese, then for them there'll be some disruption in the hormone of testosterone and the estrogen hormone in their body. So here, medical oral medication can do wonders. But if the gentleman is losing weight, then that will be really, really great. That will automatically improve their sperm count. But then, if that is not happening despite lot of insistence on this measure, then giving medical management will also help in terms of oral tablets. So oral tablets role is again very, very limited. It can be applied for only few conditions, and this is to be discussed with the fertility expert and understood. And then again, these treatment are given only for a shorter period of time, say 3 months to 4 months, and not like you can go on taking it. So when it comes to oral hormonal medication, this is what is generally done. So this was all about a comprehensive guide on male factor infertility. I hope this is I'm telling this in its entirety. I know few things, very intricate details will be missed here, but then the overall experience or a practical exposure that is that we come across as fertility consultant. I'm talking about that, and when you hear to this entire 20-25 minutes video, then you'll get the clarity as to where you stand. And if this was really very useful, if I was able to give you that clarity, then I think that is really what I meant to with this video. And if someone needs this clarity, if they have to understand how to take their decision, then definitely you have to share this video with someone who requires. And for more such information, then please subscribe to the channel. I'll be coming up with only practical issues and which is manageable or treatable in a very simple manner.